The first time a doctor explained borderline personality disorder to me, he said, "When you think of borderline personality disorder, imagine the crazy ex-girlfriend who burned your house down and accidentally killed your dog, but she wasn't trying to kill your dog, she was just trying to get your attention." That didn't set well with me because, unbeknownst to my colleague, I had recently been diagnosed with borderline personality disorder. In this presentation, we will talk about what borderline personality disorder is, signs and symptoms of borderline personality disorder, different statistics and stereotypes, and how to work with someone with borderline personality disorder, whether it be a supervisor, subordinate, or lateral coworker. Borderline personality disorder is the most common personality disorder. It is a chronic mental illness that makes it difficult for the person to manage emotions effectively. The disorder was first recognized in the 1980s by the psychiatric community. While researchers are still not 100% sure what causes borderline personality disorder, it is believed that genetic, environmental, and social factors may all play a role in the development of the disorder. Many, but not all people with borderline personality disorder reported abuse and/or traumatic separation as a child. Doctors are reluctant to diagnose people with borderline personality disorder before the age of 18. There are no medications for borderline personality disorder because there isn't a magic pill to change your personality, so they can only treat the symptoms. According to Juliet Timmons, an internet article, 9 Signs of Borderline Personality Disorder, published on August 30th of 22, there are 9 signs of borderline personality disorder. The first is fear of abandonment, followed by patterns of intense, unstable relationships, an unstable sense of self, impulsive behavior, suicidal behavior, self-injurious behavior like cutting, burning, pulling their hair, biting themselves, frequent and intense changes in mood, feelings of emptiness, and disassociation. Some things with borderline personality disorder statistics: 85% of people diagnosed with borderline personality disorder have coexisting mental illnesses and struggle with self-injurious behavior. 75% of those diagnosed with borderline personality disorder are women. 50% of people with borderline personality disorder have a hard time keeping a job. 38% of people diagnosed with borderline personality disorder have a substance abuse disorder. 17% of those in the US prison population are diagnosed with borderline personality disorder. 10% of adults with borderline personality disorder commit suicide, but only 1.4% of the adult US population suffer from borderline personality disorder. It's difficult to pinpoint cultural values in individuals diagnosed with personality disorder for a lot of reasons. Actually, some of those reasons are that they frequently shift their identities, values, and beliefs, and frequently change their minds about religious affiliations, political beliefs, and even sexuality and gender identities because they try to shape themselves into whoever they need to be to appease the people around them. Some negative stereotypes about borderline personality disorder are that they are manipulative, clingy, violent, attention seeking, and moody. But according to NAMI, only 4% of violent behavior is actually attributed to mental illness. Some positive stereotypes: they are loyal, empathetic, creative, resourceful, and intuitive. Annie Tansugurin's article Borderline Personality Disorder in the Workplace, published June 20th of 2023, offers advice on having a healthy work relationships with someone diagnosed with borderline personality disorder. Some things you should do are avoid you statements, try to keep all your limbs uncrossed, and put away any distractions. Dialectical behavior therapy is a type of therapy that's specially adapted for people who experience emotions very intensely and can help with dealing with interpersonal relationships at work and outside of work. They have hard time working in teams because of the negative sense of self and competitive nature that's needed for recognition. They enjoy regular customs and traditions, but may feel left out if they are not included in all workplace activities. Some ways to work with your supervisors or subordinates with borderline personality disorder is to be patient. Supervisors, be patient, don't judge, be consistent and set boundaries, and allow them time for therapy appointments. For subordinates, avoid arguing, be consistent, set boundaries, keep help, and seek help from your managers or boss if necessary. And for lateral, avoid arguing, set boundaries, and seek help from a manager when necessary. Ryan Light wrote an article, BPD and the Media, Reinforcing Stigma versus Portraying the Truth, published in July 20th of 2020, that explains that during the Amber Heard Johnny Depp trial, it was revealed that Amber Heard is diagnosed with borderline personality disorder, which further stigmatized the disorder that is already talked about in a very pejorative way. While borderline personality disorder is a lifelong diagnosis that can't be cured, it's not a death sentence. People with borderline personality disorder are people with feelings and emotions just like everyone else. With the correct medication and therapy, they can live a happy and successful life. Thank you.